Welcome to Healthcare Algorithm. I'm Dr. Will Strimel. If you want the real story behind today's healthcare challenges and the strategies and technologies people are actually using to solve them, you're in the right place. Short conversations, clear insights, practical takeaways. Let's get into it. Hello, everybody. Welcome back to Healthcare Algorithm and happy 2026. Dr. Will Strimel here, and I'm joined today by Milad Owji, who is a practicing dentist and the founder of DentMent, which is a company that supports dental clinicians in terms of leadership, mentorship, practice operations, and social media. So, Milad, welcome. Thanks so much for joining me today.
Absolutely, Dr. William. Thank you for having me. I really appreciate it.
All right. Well, let's get right into it. So you've been very open about your immigrant experience, and I'm proud to have the opportunity to highlight that today with you. But just, share your story, the challenges you faced, and how it shaped you and got you to a career in dental medicine.
Absolutely. Well, as the story is very similar. Me and my parents, when I was essentially 9 years old, my parents, we left Iran and we refuged to Turkey. I lived in Turkey as a refugee. For about 5, 6 years, I was there. Unfortunately, during the time that we were in Turkey, September 11 occurred, and then
Oh, wow.
it kind of delayed our departure from there. I came to U.S. in 2003, and I've been here since then. I went to Florida. My parents and we had zero knowledge of the language, zero knowledge of the culture, zero knowledge of anything. We had no idea. The only person that we had here was my uncle, and at that time, he was the only one that was here. We didn't really know anybody, but just like anybody else, we came, we figured it out, we figured out what life was about, we figured out what we needed to do, and truly, there were early on a lot of support around us that we were able to kind of get through those tough moments of, hey, what do we need to do next? What are the things that we have to do? And like I said, they do an amazing job helping the immigrants get through the system, and they had a lot of support at that time. But ultimately, for me, the reason why I really wanted to do dentistry was because when I was in Turkey, my younger brother was in dental pain, and my parents
Yeah.
financially, they were like, hey, like, I'm not in a position to pay for any dental work. So I remember my brother was crying, and then finally we found this very nice Turkish doctor that did the work at no cost. And really truly it was like an eye-opening moment for me that, like, hey, like, you took a kid that was in that pain
Yeah.
and you were able to address that, and it left something in me that I was like, man, like, when I go somewhere, I really kind of want to like do the same thing, but I didn't know what the path was going to be. Right when I came, I
Sure.
didn't really know. So I, even at age 17, I had to work two jobs to so help my parents, support my family. So my journey took a bit longer because I really had to figure out financially how am I going to do it, learn things. Ultimately, when I met one of the, so we left Florida and we went to Virginia, and I met a gentleman there named Dr. Farshad. He was a same thing. He was Iranian. He was an immigrant himself, but he was here for 30 years. He had a successful dental practice in Virginia, and he became somewhat of a mentor to me early on, and we really headed off having the right conversations. And I was like, man, I think this is what I want to do. Like, this is my calling, because like I went to his office, I saw what he was doing, and then having that experience early on with my brother, it just kind of like clicked something in my head that I was like, man, this is big. Like, you're able to actually change somebody's life by
Yeah.
giving
You
him
make
a
an
new
impact right
smile.
away, right?
Exactly. So that other stuff was very fascinating, and ultimately just made a decision to just start going after dentistry. So, and that's where we are 23 years later.
Yeah. So, everyone I've observed that has a different kind of brings a unique experience into becoming a
Yes.
healthcare professional. Of course,
Yep.
everyone
Yep.
has their own reasons, and it's a long journey, right? So we all bring
Yep.
something different. But I'm just curious, maybe if you could kind of extend on that a little bit. As an immigrant, especially as someone who comes to the United States, whole new world, learning the system. How did that? What's different about your perspective, perhaps, or has it brought something different to you in terms of kind of navigating that journey to become a health professional, even from the standpoint of financing it? I can just
Yeah.
personally, I
Yeah.
was very fortunate to have the United States military pay for my medical
Yeah.
education, but I imagine that was probably a challenge that you really had to struggle with, and how you're even going to finance such an education.
Absolutely. Yeah, I mean, there was just a lot of like, I mean, from a perspective of healthcare, when you come from a background that I come from, especially, being an immigrant, I don't want to say other people don't, but I have, my heart just have a different type of empathy for people. When I see people that are in a certain situation, my understanding alert, like, I kind of get different alert in my brain that, hey, like, I need to take the time, I need to understand where they're at.
Right.
Even my dental assistant, she's 20, 40, 25 years old, and she's like, doc, sometimes I financially I struggle, and I tell her, I'm like, hey, like, when I was your age, I was living in the car at some point. So it's like
Wow.
there's nothing wrong with like struggle in life, because that's what's motivated us to drive us forward in life. So I always explain that, like, our my life experience has brought me to the moment that I'm in from every avenue, but it also helps me connect with people in a different level in some, because I grow up so hard. I grew up in a way that, like, we had nothing, so you're able to understand people more. You're able to understand where the people are at. Just giving you an example, I had a patient that, you know, she had like no money, but her look was important. She was young lady, so I
Hmm.
did that procedure at no cost. It didn't bother me. I was like, hey, like, I've been there. She's an immigrant like myself. Like, if once in a while a case like that comes knock my door, I'm gonna do it. Like, I'm
Yeah.
not gonna be bothered by it. You know what I mean? Because I understand where that person is at. I was
Healthcare
there.
delivery is all about trust, right? And
Yep.
to have those
Yep.
experiences that allow you to connect with people in a real way
Yeah.
immediately builds trust. Wow. So
Absolutely. Sure. So yeah, no, those are where it's at. And as far as finances, yeah, I mean, the I always knew that I didn't want to do anything like, I knew that I had to finance my I have to do everything on my own. I knew my parents weren't going to be able to help me in any ways. My parents financially weren't there. They're not a rich people or anything like that. I knew dental school was going to cost $500,000 minimum to go to, but I put myself in a way that I planned everything correctly. When I got into dental school, I was in my late 20s. So I
okay.
had some money saved up, but and also, I did what everybody else does. I talked to a lot of people that were kind of like, I had the understanding of finances, and ultimately they say, hey, you got to do financial aid. You have no other option. You're not going to be able to do it. So, yeah, I just got some financial aid and start my journey, and trust that things were going to work out. And honestly, it is what it is. You got to invest money on yourself to be able to get what you want out of life. So, and that's how I
Yeah, and
look
I
at
think,
it every
and
day.
another important point there is, by starting a little bit late, you didn't lose anything, right? So having taking some time, building some a financial balance sheet, some
Yeah.
reserve, and starting maybe in your late 20s. That's good. I would think advice for younger people out there.
Yeah.
So tell me a little bit about your practice, and specifically about DentMent, in that it seems to me is that you've leaned into this concept of mentorship and helping other clinicians grow in their practices relatively early in your career. So, tell me a little bit about the inspiration for that.
Absolutely. Well, I currently practice in Tucson, Arizona. The practice, I don't own it. It's owned by a hygienist. So I'm really here to, like, I was having a conversation with her. Same thing, like everything else that I do, I wanted to kind of do something that had some meaning behind it. So when I got the call, and I heard the kind of like the calling for the help, I really wanted to step out of the comfort that I was in, and I wanted to get uncomfortable. I'm a type of person that I grow in uncomfortable situation. When I get too comfortable in life, I'm like, something is wrong. So because
Yeah.
I grow up that way, so I got to make
You get
sure.
you get restless.
Exactly. I'm like, oh man, this is getting way too comfortable for me. And as far as DentMent, honestly, when I graduated dental school, and I had a lot of conversation with my classmates, I had a lot of conversation in the industry, and especially when I transitioned out and saw really what was going on in the industry. There's three things that came up. One, why is there not a community specific platform that where all dentists, pre-dental students, dental students can go on and really connect with one another no matter where they're at in their career?
Okay.
The second thing that was kind of like for me, because I saw a lot of these companies talk about mentorship, but they don't deliver on that promise. So I wanted to know, how can I bring experts from both business and clinical side of industry and bring them into our platform, and really able to get this younger doctor to get them good mentorship that they want on a one-on-one level early on in their career. So that's the other side of it. And ultimately, The third thing that we saw was in the marketplace, like they keep talking about dentists don't have a knowledge of business. So I'm like, well, I have connection in the industry. Why can I create a university with DentMent where like we bring all these course sections that are business related into the platform so that these dental students and the dentists can really log on and sit down and watch these videos that we recorded about every part of the business side of dentistry and really learn about it early on, so that way they get educated on what's really going on. Because like going into the DSO route, DSOs are great, but they're not teaching you the forefront of what's going on. They're like, you do the clinical, we'll figure everything else out. But you are not really learning truly what the business of
Yeah.
dentistry about, the creation of the system, the things
So
that you
this
need
is,
to do.
yeah, and candidly, I don't really know anything about the career choices or the way that
Yeah.
dental grads are looking at it. So maybe
Yeah.
just, as to a novice, walk through where in your dental training are you starting to think about that decision, and how, like you're getting ready to graduate, you're looking at starting your own practice, joining an independent practice, or joining a dental service organization. Just maybe give me at a high level how someone
Sure.
walks through that.
Absolutely. So when you get to your kind of your fourth year in dental school, so the last year of dental school, unfortunately, the one thing that we saw as a dental student, we're still seeing it, is that dentistry has become just like everything else. It has become very political, in a sense. So
Okay.
whoever have the deepest pocket gets in the forefront of the dental students, so they can feed their ecosystem. So, for example, when I was in dental school, when the time come and they're like, oh, you want to go? What do you want to do? They would shut down the school, or they would have lunch and learn, and all you see is
Oh, wow.
Heartland, Aspen, Family Dental, like Pacific Dental. You see these companies come in, and they talk to the dental students, but the reality was like when we left, I was like, man, like there are other opportunities that we never got to see. Like there's companies, smaller organizations, that are dental owned, dental run. Like we never got to see that. So that's what I had a problem with. That I was like, this don't make sense. Where we're not able to see the other opportunities, and sometimes as dental students, you don't really think about that stuff. You're like, whatever they put in front of
Yeah.
us, we're just gonna take it in. They know what's best for us.
You're just trying to learn your craft at that point,
Exactly.
right?
At that point, exactly. But they don't really like when I graduated, I realized that I don't think the dental schools are even knowing what's going on. They just feeding into that machine because they have the deep pockets, so they're paying them under the table, whatever it is, just to get in front of the dental
Sure.
students to feed that ecosystem. But ultimately, you I tell the dental students even now, and the reason why I put DentMent together is because I want them to be able to see what the other side looks like. You got to have access to smaller organizations, understand where they're at, understand what they can do for you. Like you know, for example, Vision Dental Partners owned by Dr. Hughes, but he's a dentist. He owns 9 practices. He understands dentistry in a way that big corporates don't understand it because their CEO is not a dentist.
Yeah,
So they,
clinical leadership, and let me tell you,
yep,
in the health systems, it's just the same, right? It's so
yep,
important to have clinical leadership there.
absolutely.
So, and when these new grads are coming out, what would you identify as the biggest gaps are? I mean, you've just, of course, there's always still like an experience gap, right? You're just
Hmm.
now ready to learn your craft, and that's hard. You can see how it's daunting for people to want to also take on the business thing, but people coming out consistently, or when clients, new professionals are coming to DentMent, what are the things that they're most interested in hearing about right out of the gate?
Well, the biggest thing is that we want to be a platform that, especially for dental students, I want to be a platform that I'm gonna help them honestly transition smoothly out of dental school. Because when we are in dental school, we are part of a community, right?
Hmm.
Because we have dentalists, we are in the school, people are supporting us, helping us, educating us on what's really going on. But when you leave that dental school, there's really nobody waiting on the other side for you. You're just on your own. You got to figure things out. By the time you figure out what the systems are, by the time you figure out understand the people, that's going to take you 1 or 2 years to really understand where everything is at in the industry. So what I'm really trying to do with DentMent is really close that gap, have the people early on get the information that they need at their fingertip. We are in the year 2026, So we have the ability to use essentially the technology and be in forefront of
Absolutely.
these dental students and really teaching them like, hey, if you want to go the DSO route, these are the benefits, these are the pros and cons. If you want to go the private route, these are the pros and cons. If you want to start your own business, what do you need to do? What's the roadmap that you need? Like, what are the financing things that you need? I'm in the process of thinking about getting a practice, and I want to kind of like record that journey so I can post it somewhere so these doctors can really understand what it is that they need to do. What does that process look like from the scratch, from the start? So like I want it to be educational, but yet I want it to be informative for them so they can really and have a community to go back to when they need it. If you get stuck somewhere and you have a question, you can go back to the individuals that you kind of have, or even the community, just like LinkedIn. You can go post your question and get a response right away.
Yeah.
So just a lot of that. Just want it to be a supportive community for everybody, including the dentists that are out practicing, because there's a lot of dentists that practice for 10 years. They still don't know what the business side of dentistry is. And
Right, right.
I have friends that don't even know what PNL is, and they've been practicing for 15 years. I'm like, where are
Jeez.
you at?
So listen, let's take a chance then to sort of rep the independent practice. What are the benefits? Why should people give that a strong look?
Absolutely. The biggest benefit of private practice, and that's something that I overlooked myself, and this is again like me admitting the mistakes that I made, was that I always looked at when I was going to get ready to pick up a position. The one thing that I looked at was how much money am I going to receive, but I never looked at the detail of what that money was going to come with. Like what was attached to that number. So the reason why I love private practices is because, especially for the younger doctors, you are in the practice learning the craft of doing dentistry without anybody poking at you every day saying that you need to hit XYZ numbers because that's what the
Right.
business requires. So you have the freedom to step back and really truly understand the dentistry that you need to be doing early on in your career. So the money long term, when you get into the right environment, the money will come no matter what. We are dentists, right? You're gonna make money, but you have to make that decision of where do I want to go? How do I want to do things? And especially when you go into the corporate world, it's like once you settle into the corporate, you have to understand that you lose that. Doesn't matter even if you own a practice with the corporate, there is still someone dictating what you're doing.
Yeah.
You know what I
So
mean?
you find I mean, let's be real, right? The financial pressures exist from day
Yeah,
one in both.
absolutely.
Well, really in both lanes, but the
Hmm.
difference is at least you're in control in your lane. If
Yep,
you're a private
yep,
practice,
yep.
you're gonna kind of live with the benefit or the risk. Whereas
Yeah,
you find dental grads are coming out and now you're learning your craft, and you also have financial pressures to perform pretty quickly.
absolutely. It's all numbers. Like I work for corporate dentistry. I'm that guy that work and I know what the inside of it look like, right? The money is there, but the experience for us wasn't there. The things that they tell you, but I've been in this practice for essentially 7 months, and it's a small practice, but
Hmm.
my experience in that 7 months has been, I wouldn't change it for anything. If I could go back and reset the clock, I would do things all over again because I have been able to build my own brand. I've been able to do things for myself. I've been able to do a lot of things that when you're under the umbrella of corporate, you're not able to do those things. You got to be able to build your brand. You got to be able to do things that matters to get yourself out there, because if you're just staying in that bubble, we're not never going to grow as a clinician. We're only going to be clinicians. We're never going to be anything else. And I
Yeah.
see that a lot in our industry where they get stuck in the bubble of corporate and they never grow. They don't build a personal brand. They don't do anything. And the opportunities, I feel like it's limited to what you can do as a clinician. But if you're in your own practice, or even if you're in a private practice, yes, you maybe somebody else's name is on it, but you are in the driver's seat. You're able to do the things. You have freedom to do more stuff, and then you don't have to. Like when I got into corporate and I got a call and they said, HR wants to meet with you. I'm like, man, I hell with this. I'm done with this crap.
That's
I was
never a
done with
good
that.
day.
I was like, the HR wants to meet with nobody. I'm out of here. I packed my bag. I'm like, I don't want to, because the thing is, ultimately, it's like, yeah, it's accountability, but like, man, we're doctors. I'm not trying to, like, when you call me and say, I want you to meet with the HR, for what? Like, what am I meeting? Like, you know what I mean? Like,
Right,
I
right, right.
I went down the route of like putting myself in the position that I'm in. I don't want to meet with your director of whoever to tell me how to do what I need to do. Like,
So
I'm
kind of,
done
yeah,
with that.
using that to kind of move into sort of operations and practice
Yeah,
management today.
sure.
Now, this may be incorrect, but my perspective is that access to a dental practice, candidly, I see my dentist more than I see my regular physician,
Yeah,
which is, I guess, a good
for
thing. But
sure. Yeah,
um, but it has more to do with access to a dental hygienist than the dentist itself. And I say that because my sense is that it's a little bit of a different model, is that for many people the reason you're kind of just coming in is the routine visit with a cleaning, that then you get to see the dentist.
yeah,
But so I have to imagine that has number one, validate if I'm seeing that correctly, but the second is that how does that affect the way you build a practice or deal with staffing shortages, which I have to
yeah.
imagine are real.
Absolutely. I comes down to, in a dental practice, the beauty of dental practice, especially on a private level. Once people come in and they feel comfortable, like for example, the hygienist that been in the practice, she's been there for 10 years.
Right.
But when I was in a corporate world, it was like, man, it was like I was like, I see 5 hygienists in 6 months, because it was just like turn and burn, and the experience wasn't there.
Why
So,
is that though? Why would that happen that way, you think?
well, it's the same in the corporate dentistry. Is the same thing. The dentist is the same thing. They have such a high turnaround, even with the dentist, because the problem is that, again, the people. I say this a lot. I am big advocate of this. When you have people that sit on top that are not a dentist, that want to run an organization, that are dentist focused, clinician focused, hygienist focused, and you're not able to communicate, and you're putting systems in place, just because you're able to put systems in place and operate a business, but it doesn't necessarily mean that you're going to be able to retain the doctors and the hygienists.
Hmm.
Why? Because you're not understanding their day-to-day struggle. You're not understanding what's going on. So because of that, that's another reason why private practices are such a place to be, even for the hygienist, because once you're in there, you understand, you're able to connect with that doctor. You don't have anybody else above you to tell you what to do. You're able to build those relationships on a personal level. You have the ability to really understand. So in a private practice, the shortages are still there, right? I mean, with assistants, with hygienists. But if you build a good enough relationship with your staff, the staff doesn't want to go anywhere. The staff want to stay and be with you. If you're a good doctor, if you're paying them well, if you're treating them well, they don't want to go anywhere. You know, but the hygienist, like anything else in dentistry, even for assistants, dentistry is tough, man. It's tough on the body, it's tough on mind. You're dealing with different people, you're dealing with different personalities. When we go in the morning, for me as a dentist, I see 20, 30 people in one day. So every time I go in, I have to
Sure.
change myself from the situation that I'm in. At some point, you get burned out, man. You hit the wall and you're like, this is getting rough. It's not that you're changing who you are as a person, but you have to kind of like change your positioning and how you're kind of approaching certain things. It becomes
Absolutely. You have to
tough.
quickly meet everybody where
Yep.
they are, right? And
So
listen,
yeah.
dentistry, I'm sure, is a lot like healthcare in that, let's be real, people don't necessarily want to be there, right? It's a
Nope.
service that we're providing
Nope.
that people need and have to be there. So it's not
Yeah.
like people generally look forward to it. So yeah, that
I
is,
know.
right?
And then every time on the fifth time, when the patient tells you they hate being there, you're like, okay, I get
Right.
it. But no,
So
it's fun.
how does that impact building a practice? And I'm sure you in DentMent, I would imagine you address this in some of your kind of guidance and people, early career clinicians or anyone really who's trying to build a practice. How do you think about staffing? Because I think it's probably very important how you approach that.
Absolutely. I think the staffing part is one of those things where you have to really, when you get into a practice, if you're getting into an existing practice, I always tell myself, even the practice that I came to, I'm like, you got to give yourself about 90 days when you get into a practice. If it is existing practice and you get into it 90 days, you analyze the people and then you see if you're connecting with them. If you're not, because that's where the biggest problem comes in. It's like doctors don't connect with the staff, there's a disconnect, and that disconnect turns into turnover. So if you're able to address that early on and understand that if I'm going into work and I'm not, clicking with Jim, then I gotta let Jim go and look for somebody that really truly fits into your system. If they don't fit in, it doesn't matter how much you push it, it's not gonna work. And that's the problem that I see. It's like even when I was at a corporate, my regional manager was like I think she worked at a clothing store and they made her into a regional manager. So I'm like, the disconnect, there is so much disconnect that I'm like, man, I made a comment one time. I said, you guys treating this like you guys running an ice cream shop. I'm like, you're just a healthcare institution.
It's
But
so
like that,
different.
yeah,
Absolutely. You have to really view everyone in your practice
yep,
as a professional, right? You have
yep,
to invest in them
yeah,
because the reality is, my experience is that my support staff spends way more time interacting
hmm,
with patients than I do.
absolutely,
Right. And so if you
absolutely.
don't invest in them and treat them as professionals and give them the tools, then they're not a commodity. And I think we're learning about that really quickly, that staffing shortages have a huge impact on our
Absolutely.
ability to practice.
Absolutely. And like I said, just realizing when you're going in, and the reason why the shortage of staffing is happening, I mean, I say this as a dentist. Some dentists are hard to work with, man. They're not fun. You go in there, they're rude, they're obnoxious. I hear stories they throw like instrument at their assistants.
Wow. Yeah.
It becomes very hard when you're not able, I mean, listen, do I get frustrated? Absolutely. There's days I go in and I get frustrated about things, but being able to kind of step back and like say, okay, I need to figure out what I'm doing and approaching it in a way that is not coming at a bad place. That's where you're able to really connect with your staff. But when you're being obnoxious, loud, and you're being rude to your staff, they're gonna leave, man. They're gonna be like, man, I don't get paid enough for this.
Right.
So
And look, let's
they're
be
gonna,
real. They have other options, you
yeah,
know?
they do.
Um,
When you're paying somebody $25 an hour and you're yelling at them every day, at some point they're gonna be like, you know what, I'm gonna go do DoorDash. I'm gonna go do Uber Eats and probably make the same amount. So ultimately, that's what
no,
it is. The
on
times
the
have
flip
changed.
side, you kind of gave a passing reference to technology earlier, and I'm sure you spent a lot of time thinking about it and talking about it. So, as you look at the technologies, and I think there's a lot that can help with staffing, but I know every time I seem like I visit with my dentist, there's some new service or new that seems technology driven. So I feel like there's a lot out there, and a lot of, I would imagine, please, feel speak on this. A
Sure.
lot of revenue in dental practices comes out of pocket. It's a little bit
Hmm.
different than traditional healthcare. So, how are you looking at the technologies that are out there? What, in terms of how you are willing to think about trying something? What's solving the biggest problems right now? How do you kind of go through that mental framework of fielding? Yeah, this is something I think will make a difference, or now this is something that is more hype than
Yeah.
substance.
Well, the one thing that I want to talk about is that what the dental practices, and I had this conversation with the current practice that I'm in, and from day one that I got there, I said you got to create a system that does not rely on individual. And what I mean by that, if somebody calls out, you got to have systems in place that you're say, you know what, my operation is going to continue. That's what technology has done for our industry. For example, I am on an advisory board of a company in Vancouver, Canada called Allo AI. That company does everything from answering the phone with AI to now they're working on verifying insurance. They're working on making sure that that conversation the AI is even having with the patients are being recorded. Your staffing stuff is being recorded, so you can give feedback to your staff. So that's what technology is doing for practices. If my office manager don't show up or my receptionist don't show up, now I'm relying on the AI to answer my phone calls. So now that's the system that I'm putting in place to ensure that I'm not relying on individuals, right?
So it's helping you build redundancy and even some resiliency in the practice.
Exactly. So that way you're not relying, that's what technology is doing. You're not relying on people. For example, like the practice I'm in right now, I talked to them about, I said, hey, who does your revenue cycle management? Well, she's like, I'm doing some of it. This person is doing some of it. That person is doing some of it. So imagine you have this big pot that you have four people's hand in it. So what happens if one of these people don't show up? What happens if two don't show up? What happens if three don't show up? So now your systems are broken because it's relying too much on individuals. Me, I look at it, for example, if I want to open my own practice, I'm already in the conversation with an RCM company. I'm outsourcing this to somebody else. Why? Because I say if my staff don't show up, my system's going to continue working because I outsource this to a company. So you gotta use the technology, the people, the individuals to create a system that doesn't rely on people.
So is there something now drilling down a little bit on that
Yeah.
specific about the technologies that you're looking for? Because let's be real, right? Right now, anyone's slapping the word AI on something,
Mm.
and it's, you know,
Oh yeah.
that's not enough. So yeah, like, you
Yeah.
know, or like, and like as a second part to that question, for to the people who are listening, as the developers, the engineers who are wanting to get into maybe this space, what do you wish they would think about? What could they do that would really make a difference?
When I look at systems that I want to bring into practice, there's two things that I look at, or maybe three. One, how can I improve the patient experience from a perspective of what I mean by that? If a patient walks in and my staff is on the phone trying to verify insurance, you took away from that patient experience. So
Absolutely.
that's what I look at. I'm like, can AI help me answer my phone and my staff can say hello to a patient when they walk in? That's what I care about. That's the first thing that I care about, right? The second thing is whenever system that I'm trying to purchase, does it have any sort of return on an investment, right?
Absolutely. That's the big
So
one.
that's a big one. If I'm spending $700 a month, what is that $700 a month going to give me? If I'm just spending the money on a product that doesn't do nothing for me, then what am I doing, right? And the final thing is, if people want to create anything, you have to think about it from a perspective of what is this going to do to take a pressure of running a business from the dentist. If you're making things just to make it, it
Hmm.
doesn't mean nothing to me. But if you come to me and say, Doc, I created this system that's going to help you automate your payroll and you don't have to worry about anything. And we're going to let you know how many hours your staff work. We're going to let you know what is done. We're going to let you know about all the legality that comes with things. Then at that point, I'm going to look at that product and say, oh, it's going to save me 5 hours a month. I'm going to pay 300 bucks a month for the subscription. That 5 hours, if I'm chairside, that's extra $2,000. That's a good return on my
Yeah.
investment. So that's how I want people to approach anything they're building for the industry. You
Yeah.
have
So
to look at it.
reducing real pain points, right?
Hmm.
Return on
Hmm.
investment. And
Yep.
we're going to come back to the patient experience. But
Yep.
to the first one, how can they really understand those pain points better?
Whenever anyone, if I'm, for example, when I was building DentMent, I sent out a survey and I said I want to know from 50 dentists what is the problem that they're dealing with, right? And then I looked at it and I said, from these 50 dentists, 40 of them are saying the same thing. So that is my entry point into the what I want to solve. I know the problem is there. Now I got validated what the problem is. Now I'm going to go find the solution and address it. But when you're just thinking in your own head that the problem exists and without doing research, you're building something and then you say why it didn't work, it's because you're not having those conversations. You're not going out to 5, 10, 15 dentists and really say, hey, what is the thing that's bothering you the most about your business? And then you go back, you ask the next guy the same thing. And then you collect data, and based on that data, you bring what's in your head into vision. But if you're just building things just to build it and then trying to sell it, it's going to be tough.
Do you think that the people who are developing the technology are really getting into, like, do they have access to dental professionals to understand this? Are they trying, or is it are dental dentists saying, look, I don't have time to deal with this? I mean, it sounds like you're balancing a lot, right? You're balancing building a practice. You have DentMed. You're on advisory board of a software company. So like, I'm sure they really value your input, but is the larger dental professional community engaged in the technology?
They are, if you approach it the right way. I, for example, when I wanted to build DentMent and when I want to have a conversation, I try to have a conversation at an angle of, hey, I see a problem and I want to solve it. Can you help me? Instead of reaching out and saying, I have this platform that I want to build and I want you to be my guinea pig, the dentist is
Hmm.
going to be like, no, thank you. But if you say, hey, I see a problem, I want to solve it, I want to get your feedback, and people are open to those conversations. I reached out to so many doctors a year ago before on LinkedIn. I'm like, hey, doc, I'm trying to do this, I'm trying to do that. But I approach it as, hey, I'm a recent graduate. I want to figure what it is that I need to do, and I want to do it. And I went out, I spoke to the right individuals with people that are, you don't want to go, you got to know your audience too, right? I can't go talk to a 90-year-old dentist, a 70-year-old dentist.
Sure.
It's
No.
You got to go talk to the younger dentists that are like that are interested in those kind of things, right? If I'm going talking to a 70-year-old dentist about DentMent, this is gonna be like, dude, I don't care at this point in my career, right? They're
Right.
not interested. But if you go to somebody like Dr. Hughes that is grinding it every day, they have a better understanding of what you're trying to accomplish. But I believe the technology, the people that are in the technology, they have to really, really get down and understand that where is what problem you're trying to solve, go to the right audience, get some feedback, and then build it on that. But if you're just gonna build random product without having doing research, it's just never gonna work.
Yeah. Or sometimes, I can see how a lot of times the development comes from the standpoint of looking at, okay, where's the revenue, where's the
Mm-hmm.
opportunity? Okay,
Yep.
let's fix it at that level because we think there's a lot of revenue there, when it might not really be fixing a problem for the actual day-to-day life
Yep.
of the dental professional.
Yeah.
And like along those lines, then at the what you really want to fix problems for are patients, I think,
Yep.
right? And that at the end of
Absolutely.
the day, this stuff has to make a difference in the lives of patients. So from your perspective, other than the actual dental procedures and whatnot,
Yes.
so we know patients don't like that, but like a little bit broader, from the quote unquote patient experience that you mentioned earlier, what's hard for patients in that? You know what I mean? What is it about the dental experience that's lacking right now for
The
patients?
one, yeah, for patients, the one thing that is lacking for patients is the problem. There is a big disconnect right now in our industry between trying to figure out. Sometimes patients have a hard time understanding that dental insurance is just a discount card, right? So when they
Hmm.
come in and they say, I tell patients all the time, I'm like, yeah, they're giving you $1,500. You gotta wait 6 months. They don't cover much. So sometimes they think it's the dentist that is like being weird or being like, I'm like, no, it's not us. It's your insurance company that doesn't allow us to do X, Y, Z. So I'm really like trying to figure out a way, even right now, with like, for example, patient experience, transparency with pricing, making
Okay.
sure that when patient walk in right now, if I wanted to open my own practice, I want that patient even before they get into any treatment, I want that patient to have a full understanding of their insurance. So what I want to do is that, for example, if I'm outsourcing my insurance verification process, I want that company to provide me a simple, very simple, the patient can understand of like, hey, your insurance company only covering XYZ. This is your waiting period time. These are the things you need to know. So even before that patient goes in the back and sees the dentist or sees the hygienist, they have a clear idea of like what is their insurance company covers, what are they not covering. So that way, if in an event something happens, you removed yourself from that situation. So the
Is there anyone
patient,
out there who's doing that well right now? Any companies or any
no,
concepts?
no one is doing it well. But what I actually found out, actually that's something I've been doing research on myself. For example, the reason why I spoke about outsourcing is because I spoke to a lot of revenue cycle companies. I talked
Hmm.
to independent ones, big ones, all of these things. Once again, when I talk about outsourcing, I found the companies, for example, in India right now, that they do revenue cycle management. They have a billing department that handles everything. So what I'm talking with them about is that, hey, what it is that you guys are doing that is different, right? From now, the cost is efficient for the dental practice. The dentist doesn't have to spend a lot of money, right? You can keep it at a minimal expense. And the second thing is they're doing a lot of the things that your front staff has to do, from insurance verification, from posting payments, from doing all of that. So the one thing that we discussed with them was, hey, if you're verifying the patient's information, can you send me a snapshot of what is that patient's insurance going to look? So essentially, send me a small summary of everything that that patient has. So when my front office or my office manager is talking with them, they have a snapshot of what their coverages are, so we can explain that to the patient. So that's something that I'm working with them right now.
Do patients have a way, and this I'm asking because I don't know
Yeah.
the answer to this at all. Do patients have a way similar to quote unquote patient portals in the traditional healthcare sense? Do patients interact with their with dental practices in that way, or is there electronic communication formats, or even just the concept of electronic health records?
Yeah.
How is that similar yet or different in the dental world?
Honestly, dentistry is behind in everything by 50 years. So that's something I'm gonna throw out there. Yeah, dentistry is unique in that way that, like, they're just getting around, like, we're in the year 2025, and I'm looking at some of these practices, and I'm like, like, for example, the broker called me and says, I have this practice in Chicago, and they send me a photo. I'm like, why is he still having paper charts? It's year
Oh,
2025. Like, come
yeah.
on, man. So, like, these are what I'm saying. Like, dentistry is very behind in a lot of things. And again, that goes back to why the patient experience lacks sometimes in the dental practices, is because of the fact that there's really no clarity of, like, okay, well, we verified your insurance. Okay, then what? Does the patient understand what they have? Does the patient understand where they're at? Well, the patient should know. The patient don't know nothing. They don't know insurance.
Why do you think it's behind? Why is that?
It is because, unfortunately, we have had way too many older generation that has not gone through the transition, and the younger doctors that are coming now, when they buy these older practices, by the time you kind of get it out of the old model and bring it into the current model, it takes time. And also, a lot of people, from technology standpoint, a lot of people, it seems like, didn't invest a lot of time trying to solve a lot of problem in dentistry, because the medical was so big that people, a lot of these companies didn't really think that dentistry, they're like, yeah, it's there, but is it really, does it have needs, does it need anything? But then slowly now people are coming about, everybody's like, AI this, AI that. And now with the AI, in the past year and a half, I don't know anybody, even a light in your dental office now, they're like AI, and they sell you that. And I'm like, I don't care about it, right? Technology is good if it makes sense, not
Right.
just anything. If it's effective, if it's efficient, if it's like, all of those things, even. And now, like, a lot of dentists, the one thing I'm proud of is that a lot of dentists are getting into, they're seeing a problem, especially younger dentists, and they're trying to solve it, which I love, because that's where you see the really huge difference and the impact, because the dentist deals with the same problem, they understand the problem, and now they're trying to address it time.
So then, just to kind of head towards the end there, and that very framework, as you look ahead to the next 5 to 10 years, and I want you to say, okay, this is where the practice is now. This is where the general dental practice is now. This is what technology promises or can do. If everything goes right, what makes you excited about what's going to change in the next 5 to 10 years?
The one thing that makes me excited is using technology to essentially advance the patient experience, and then make us as a dentist to be able to focus more on the clinical, focus more on the patient experience, and rely less on human being. Because I believe the hardest thing that we deal with in dentistry is dealing with the staffing, right? If we're able
Right.
to kind of put a system together that can work without individual touching anything, there can be less error. It's more comfortable for us as a dentist. If I can run a practice with 3 staff, I would love that. That I can have 2 assistants, one front person, and that's it. And I'm outsourcing everything else and using technology. Then I'm in a driver's seat, and I control more of what I do, because if I can get into a dashboard and see what they've done at the end of the day, it's a lot easier than and keep going to individual. Did you do this? Did you do that? Did you complete this task? So it
Mm-hmm.
makes it easier for us, even as a clinician. So I'm really excited about seeing where things are going, and essentially try to automate as much stuff as possible using technology. I'm not saying like humans are shouldn't be there, but I want us to rely less on humans and more on technology so that we can better the patient experience and make the doing the business easier for us as clinicians too.
Okay. So the one best piece of advice to close up here that you would give to someone considering a career, whether it's, as a technician or a dental professional, a dental physician, or someone just starting out, what's that one key advice that you wish you knew?
Well, the one thing, the key advice, if somebody wants to get into dental school, are they even thinking about becoming a dentist? One advice that I'll give you: if you're not a people person, do not get into this business, because this is the business of people. If you don't have a personality, if you don't have the heart to serve others, don't get into it. This is not an easy business. You're gonna get into it, you're gonna burn out very quickly, and you're gonna step to the side. And I've seen that over and over again. As far as technology for advice, take your time and really understand the problem and try to solve the problem that actually matters. Don't just build something to build it, because if you're building something that has no meaning to your audience, they're not going to care, right? So really understand what you're building, if it has any true impact for the dentist, for the patient, and everything else. And for the dentists that are out there, understand the business of dentistry, man. Get in the driver's seat, be a CEO of your own company, learn the craft of the business, and really build your own brand. And the opportunities are endless. I build a brand, and that's why we have in this conversation, right? So you gotta build a brand for yourself. You gotta get on social media. You gotta put yourself out there so that when the patient walks in, they can feel like they already know you as a person and not just as a doctor.
How can we hear and see more about DentMent?
Well, we are pretty much on LinkedIn. We are on all social media. If anybody has a question, I'm on LinkedIn. They can just reach out to me, Milad Owji, on LinkedIn, and they can. I'm happy to have a conversation. Our platform is up and running right now. We are building iOS and Android app as we speak, so that should be ready in about 2 months. And
Okay,
then,
great.
but I'm super excited for what's ahead, man. I think it's going to be amazing 2026.
Milad, this was great. I learned a ton today.
Yes,
Really,
absolutely.
really appreciate you joining me.
Yes, Doc. Thank you so much for your time.
Absolutely. And for everyone out there listening, thanks so much for joining us. We'll see you next time. Till then, be well.